Is it a good idea to walk with painful hip osteoarthritis? The answer is a big no. You should not be walking with painful hip osteoarthritis. And here's why. If your hip joint is irritated and the lining of your cartilage on the ball and on the socket joint is not liking you bearing weight and repeatedly taking steps and moving the way that the hip joint has to, that means that it's irritated, and you're going to further irritate it the more you walk on it and the more you bear weight through it. So going to go walk for exercise, even if a healthcare professional told you to do this, is not a good idea. It's a sign that they may not be an expert in healing hip arthritis naturally, and you need to revisit this a bit. I'll unpack this for you so that you know how to approach your healthcare provider regarding walking when it's painful. This is not a no pain, no gain situation. That only applies to where you're healthy, you don't have hip arthritis bothering you or any other issues bothering you, and you're trying to push through exercise fatigue. The pain of exercise fatigue is what people are referring to when they say no pain, no gain. But when you have an issue, a condition like hip arthritis, you do not want to force anything that hurts. Now, the only time that I do tell patients to force some pain, besides fatigue if they're already healthy, it's if they've just had surgery. Because if you've just had a surgery, you're healing from the procedure. You've got incisions. You might have stitches. You might have other things put in you, joint replacements or screws or other things, plates. And those things are going to hurt in your body initially. And you have to be able to move around with those things in your body, with the scars healing, with everything else under your skin healing. And so you do need to force some movement if you have had surgery. But if you're trying to avoid surgery, it's a different ballgame. You actually want to listen to that pain and avoid it. You need to use it as a guide so that you know when to push and when not to push, and that you're doing it right or that you're doing it wrong. Now let me unpack that doctor's recommendation for you, because maybe you're trying to do well and follow your doctor's orders or do what your physical therapist told you to do, and they may have told you, go walk on the treadmill, go walk outside, go walk a mile or walk for so much time, and you're trying to do that, but your hip's hurting. Think to who those doctors, physical therapists are usually treating, because if it's a general doctor, a general physical therapist, especially if it's a surgeon or like an orthopedic doctor, they're dealing with people that are getting hip surgeries. The physical therapist is helping people after they've had a hip surgery. Remember what I said, the only time that I tell people to push through pain is if they've had surgery. So what I find is when I get patients here in my clinic, when we talk to people online that are pushing through pain and they've been told by a doctor or physical therapist to walk through pain, it's because they're dealing with a healthcare professional who's used to treating people that have had surgery, and they're treating them the same. They're treating you, the person who's trying to avoid surgery, the same as somebody who's had surgery, because you do push that person a bit. They need to move even though they've had surgery. But if you have not had surgery, you're trying to avoid it, don't force yourself to walk through pain. So what do you do? What do you do instead? And what do you tell the doctor? What do you tell your physical therapist? Well, what you should do is stop walking, of course, only walk what you need to, and actually should be offloading. So when you need to walk, like if you have to get around through your house to go to the bathroom, you have to go to the store, take care of your daily things, whatever you have to do for life, you should be offloading your body weight with something like this. Get yourself a cane. Get yourself some crutches. Either of these can work. And if you need more support, get yourself a walker, like one of these. I'll put links down in the description if you want to see which ones I got. They're from Amazon. But any of these devices can help you to offload your body weight by leaning on them so that you're not putting your full body weight through your painful hip every time you walk. You need to be using these, even if you think it makes you feel old, even if it's annoying to carry around. If you can use it just long enough to offload your hip and allow it to heal, then walking gets easier, and then you can progress to a point where you might go do it for exercise. But even before going there, there's some other things you need to take care of, like fixing the muscle imbalance, making sure that your muscles are firing correctly. There's certain muscles that should fire at certain points in walking. I go into all these details in my channel here, as well as in my hip arthritis recovery program. That's where I go the deepest into it. Which, by the way, if you want a step-by-step process on how to fix hip arthritis naturally by a specialist like me, I've packaged it all in a program called the Hip Arthritis Recovery Program. You can learn more about it in the link in the description below. And then you'll find a playlist for all our hip arthritis videos also down linked as a link in the description as well. Hey, thanks so much for watching. I hope this benefited from you. If you're out there walking through pain, please stop. Review this video again. Think it through. And if you have that doctor or that physical therapist telling you, show them this video. Let them see it. Let them think it through as well, because they are probably hurting other patients unknowingly. They don't mean to. They're just trying to do the best with what they know. And they don't know that they're hurting. You may not. Nobody's given them feedback and told them that possibly. Or they're thinking, my patients are being wimps and they need to just push through it. But that's not the right thing to do. They need to be using these things until they can walk properly and use the right muscles. Hey, don't forget to give this video a thumbs up and please comment. And if you haven't already, subscribe. Thanks so much for watching. I'll see you in the next video. Bye-bye.